Hi there, Arslan here, the osteopath. So we're going to use an example of a tennis elbow, golfer's elbow, sort of elbow tendinopathy in a patient here. And we're going to go through how we would approach this from like an osteopathic lens. So we start with a seated assessment, and we're going to kind of look at the spine first to kind of see what is happening at the foundation of the body. The reason we do this is any sort of restriction in your thoracic spine especially will play a role in that scapula and the shoulder blade. The shoulder blade kind of does groove over that T-spine and has to have a relationship that is smooth over there for things to work out through that area. And the reason we care about the shoulder blade, obviously, is we have a lot of musculature that originates from that shoulder blade and all its joints and muscles, and that will travel down that elbow. So we take a look to find any restrictions here to see if we can clear that up before we get to the elbow. So after we worked through that T-spine restriction, which obviously is probably one of the most important steps in all of this, we start to investigate through the actual shoulder joint itself, the relationship with the collarbone, with the arm, with the shoulder blade like we just spoke about, as well as the actual humerus, the arm, the elbow and all that. So initially here, I'm trying to look at the range of motion in the shoulder of the patient. And if we notice sort of a restriction, we can kind of work through that. And then once we work through all of that and we've sort of found some restrictions, we can, at that point, travel down to the elbow. Looking at that area, we can kind of take a look at what could be holding some of the restrictions through this elbow. We can clear up some of the smoke at the end, and then eventually also taking a look at the wrist itself, because naturally there will be some sort of effects at the wrist. So once we've successfully sort of worked through all that, we obviously want to reassess and make sure we've made some changes that are helping the patient. Obviously, some of these tendinopathies are not going to be able to clear up in one treatment. However, we should see an improvement in range of motion. We should see the elbow start to relax, the wrist start to feel better if there was any effects there, and we should see an improvement in performance there.